Picture this. You walk into the GI doctor and you tell them, I don't know what's going on. And they say, well, it could be IBS or it could be SIBO, small intestinal bacterial overgrowth. Now, here's the thing. Many of us have gotten this diagnosis and really feel this sense of either despair or hope, depending on how it's presented. Well, if you're one of the lucky few that gets presented with, it is a curable thing. However, what do we do if it continually comes back? Dr. Zach Spiritos joins us on this Quick Connect and breaks that down just a little bit better for us. Stay tuned. Life moves fast, and so should the answers to your biggest questions. Welcome to Endo Batteries Quick Connect, your direct line to expert insights. Short, powerful, and right to the point. You send in the questions, I bring in the experts, and in just 5 minutes, you get the knowledge you need. No long episodes, no extra time needed. And just remember, expert opinions shared here are for general information and not for personalized medical advice. Always consult your provider for your case-specific guidance. Got a question? Send it in, and let's quickly get you the answers. I'm your host, Alana, and it's time to connect. Today, I'm joined by my guest, Dr. Zachary Spiritos, a board-certified neurogastroenterologist with a passion for treating irritable bowel syndrome, functional abdominal pain, and mobility disorders. He brings a wealth of knowledge and compassion to the table. Please help me in welcoming Dr. Zach Spiritos to the table. What's the best approach for treating SIBO in complex conditions like endometriosis, mast cell, all of the things?
Yeah, so I think we overthink SIBO sometimes. From a pathophysiologic, mechanistic perspective, it is quite complicated. But fortunately, the treatment is pretty basic, and it's antibiotics based on what kind of SIBO that you have. And these antibiotics aren't like traditional antibiotics. They are more like eubiotics, which really just shift your microbiome to something that's a little healthier. And they're not absorbed systemically, so they are fairly well tolerated. That said, if someone has MCAS and responds to this medication, Rifaximin, which is traditionally used in SIBO, unless you have a different type of SIBO, that's a different conversation, then that's different. And you just can't take the medication because you have a reaction to it. But that's, in my experience, few and far between. The harder element to this is how do you get it from coming back? And that's all identifying why it was there to begin with, okay? And was it antibiotic use? Was it a PPI use? Was it chronic narcotic use that really slows the bowel down so that bacteria has a chance to proliferate? And if you target that, and sometimes we're good at it, sometimes it's tough to identify, then we can prevent it from coming back. Because SIBO can come back over and over again. You can continue to treat with antibiotics called Rifaximin. And again, there's another one that we can use for a different type of SIBO. But that can be, people don't want to be on antibiotics in perpetuity. So it's really trying to understand why it's there and then treat that. And sometimes we use pro-motility agents to help the small intestines squeeze, to help the kind of the small intestines peristalse adequately and get small bacteria to where it should be in the colon, or removing offending agents like PPIs, narcotics that could lead to conditions like small intestinal bacterial overgrowth.
Do you combine that with a low FODMAP diet as well?
I don't. So the low FODMAP diet can be quite restrictive. And does it work in SIBO? It does. But I think we just treat the SIBO. And so if someone has recurrent SIBO over and over again, or just it's not getting better with Rifaximin, which again is really, really rare. But if we test people and they're just not getting better, then there are diets you can use. You can use an elemental diet, which effectively is starving the bacteria, and you're really just giving food in its digested form. So you can imagine how tasty that is. It's pretty gross.
Yeah.
We don't use that unless it's a last resort. But yeah, SIBO, I have had patients who just continue to get SIBO over and over and over again because they have bariatric surgery and these kind of blind loops of intestines that continue to kind of just cultivate growth of this bacteria that lead to ongoing fermentation. Then we will use a SIBO low FODMAP diet, but sparingly and on a case-by-case basis.
Side note on this, endo patients are really big for SIBO.
It's really not that complex. And so here's my issue with like functional medicine doctors where they don't work in science a lot. A lot of it's pseudoscience where they just, a lot of it's not based on clinical data, and they turn SIBO into like high dose oregano or high dose garlic. And you're like, okay, well, sure. But we also have an antibiotic that works really well and it's really safe. And so in that world, they really harp on SIBO. And yes, it happens. It's not that common though. In fact, when someone's really bloated, they oftentimes just need to poop more. Like I was like, am I bloated? Do I have SIBO? I was like, we haven't pooped in 10 days. So like, maybe let's work on that.
Probably not. Probably just need to poop. Just
And another one is like Right, 100%. Another one is like pelvic floor dysfunction, which is
Mm-hmm.
really underlooked. And if you can't evacuate stool, you can't evacuate gas. And it's tough to treat. It really is. You got to retrain the whole pelvic floor. And people kind of want an antibiotic or a medication to treat that. But it's just, it's glossed over. I
Yeah.
tell you, if I have a woman who's in her 50s and 60s who have a lot of bloating, pelvic floor is at the dyssynergy is like the top of my list.
Yeah. It should be for, I think, pretty much everyone.
Yeah.
Like pelvic floor is a huge, huge issue. And actually, we don't know any endo patients that don't have pelvic floor dysfunction.
I bet.
That's a wrap for this Quick Connect. I hope today's insights helped you move forward with more clarity and confidence. Do you have more questions? Keep them coming. Send them in, and I'll bring you the expert answers. You can send them in by using the link in the top of the description of this podcast episode or by emailing contact@endobattery.com or visiting the endobattery.com contact page. Until next time, keep feeling empowered through knowledge.